Hi, I'm Harris Harrington, creator of Depersonalizationrecovery.com, and the topic of this video is health anxiety and depersonalization. Health anxiety, commonly referred to as hypochondriasis, is a mental problem that often afflicts people that also have depersonalization disorder, which is a dissociative disorder highly interrelated with anxiety. Now, hypochondriasis, health anxiety, is obviously a subset of the anxiety disorders. So in health anxiety, people are afraid they have an illness that they actually don't have. And they often run to the emergency room, get tested, and they find that they are completely fine. So health anxiety and depersonalization have a very interrelated relationship. The reason is that health anxiety is an obsessional disorder, and it's also very body focused. Okay, so let's break that down. Obsessional and body focused. When people have health anxiety, they can't get the idea out of their head that there's something wrong with them. Even if they know that it's likely that they're fine, they just can't get the thought out of their head. They obsess over it. They search the internet, they're looking on medical websites, learning about the disorder. And it's also body focused, meaning that the obsessions are focused on the body itself. So maybe people are looking at their skin, they might think they have a headache, they might think that there's some sort of muscle twitching going on, or, they think they feel pain, it's very dull, they're not sure. So it's body focused, and it's kind of what they call psychosomatic, meaning that the thought you're having of the disorder actually manifests the feeling. So you're thinking there's a problem with your stomach, and all of a sudden you start feeling like you have stomach problems, even though you don't. Now, you have to be careful with this, of course, because sometimes you actually do have a health problem. And I don't think there's anything wrong with researching things on the internet. I say go ahead and do it. But it's one of those disorders that's very common, okay? Now, the other reason why depersonalization and health anxiety are so interrelated is that people with depersonalization don't feel very well grounded in their body, right? They just don't feel like they felt before. They feel very unreal, right? They feel derealization towards the external environment, often feeling like they're in a movie or everything's two-dimensional. Or they feel like, they're not really in their own body. They don't feel like they're in control of things, right? And oftentimes, depersonalization occurs during a panic attack. And when people feel this thing for the first time, they first feel depersonalization, they oftentimes believe they're having, a severe mental problem, like a neurodegenerative disease. Okay, but they actually aren't. So people in depersonalization, they feel very strange in their bodies. Now, if you actually have symptoms of a disease that could kill you, what do you have? You feel things, right? So you're supposed to feel a pain somewhere, or you see a rash on your skin, or, you feel something. You're supposed to feel something. So if you have depersonalization and your sense of feeling your own body is out of whack, then it makes sense that you might be confused. That you might be confused as to whether or not you have a disease that could hurt you. So you go to the emergency room because you're feeling very strange. Now with depersonalization in particular, like I said, people are afraid of having a neurodegenerative disease, right? They're afraid, sometimes they might fear that they are suffocating, that their heart might have a problem, etc., because they oftentimes have anxiety. So symptoms of anxiety include having a racing heart, feeling breathlessness, feeling a headache, and all these kinds of things. And it's just basically not valid most of the time. Most of the time when people have depersonalization, they're freaking out. They're actually fine. They basically have this dissociative disorder, which also is very intertwined with anxiety, just straight up panic disorder, generalized anxiety. So these two things are very interrelated, and it's really for these reasons I've said. That they're both obsessional disorders, they're both body focused, and people with depersonalization feel strange in their body. Probably the biggest fear that people with depersonalization have is the fear of going insane, and I've got a whole other video on this topic, but people are afraid that they're going to go insane, right? They fear that they might be developing a psychotic disorder, like schizophrenia or something like that. When in reality, depersonalization is not a sign that you're developing a psychotic mental disorder. It just isn't. That you feel very strange. You might fear that you're going to go insane. You might fear that you're going to lose your sanity, but you're really not. I mean, it's not a sign in and of itself that you are going to go insane. So people with hypochondriasis, they tend to go to the emergency room feeling that something bad is going to happen to them, and I know I've done this too. I've gone to the hospital afraid that they have a problem, and you know, I don't think it's bad. Like, I don't think hypochondriacs should be stigmatized for having these fears. I think, you know, if you are a hypochondriac, you might want to look into getting a really good health insurance plan, even though you're probably very healthy, but it can save you a lot of cash. Now, I also think that you need to engage in some cognitive behavioral therapy to challenge these fearful thoughts, these obsessional thoughts, and to really realize that you are okay. So I hope that really helps. You know, people with depersonalization, they fear going insane, they fear having a neurodegenerative problem, and they fear that they're going to die at any moment of a heart attack or you know, their lung collapsing, whatever. But you're probably healthy. Depersonalization tends to afflict younger people as well, and you are probably fine. So I hope this video helps. Check out my website, depersonalizationrecovery.com, free articles, free videos, and my program, and subscribe to this channel for more videos in the future.